It's now my turn. It's now my turn to introduce Pierre Roca to you, a real European citizen. He was born in France, where he studied political science and then moved on to Belgium at the College of Europe for his EU studies, and is now living in Denmark. Until recently, he's been the editing director of an online magazine that was specializing in discussing EU issues, the Euro. A magazine which is available online in 4 different languages, and whose contributors are all volunteers, whether they are journalists, students, or academics. To this day, he's still the vice president of the association that manages this magazine. Pierre is here on this session talking about health issues in his capacity as a global public affairs advisor with Novo Nordisk, which is a company specializing in diabetes, where he works in the department Global Stakeholder Engagement. Pierre.
Thank you very much. Dear Counsellors, organizers of One Young World, and fellow delegates, it was a positive surprise when I first heard of One Young World, not only because I strongly believe that young people have a voice that needs to be heard, but also because I believe that the global issues that we've been discussing during the last 2 days and people's health and well-being are mutually dependent. There are 3 central dimensions in this resolution that I would like to cover. First, the right to health that we mentioned in the previous speech. Secondly, priorities on the global health agenda. And finally, the role of stakeholders in making change happen. Let me start with the right to health. Several international conventions and national constitutions recognize the right to health as a human right. This can be defined as access for all people to an effective and integrated health system. But still, the reality is that millions of people continue to die prematurely. Millions more don't have access to essential treatment and basic healthcare information. We can ask ourselves the questions: have the world's leaders failed in their task to deliver the conditions required for people to live healthy lives? This task is more than just a moral obligation. It also makes good sense from a socio-economic perspective. Healthy people are a precondition for human, social, and economic development. This is a fact that has been recognized by a wide range of actors involved in seeking the achievement of the United Nations Millennium Development Goals. Half of the Millennium Development Goals are related to health. This dimension is relevant to the world's poorest countries and to high-income countries alike. All this means that health should not be seen as a separate topic. It's an horizontal issue that needs to be addressed and integrated in all relevant policy areas: economy and finance, agriculture, environment, labor, education, and social affairs, to mention but a few. How we can ensure that this right to health becomes a reality? This brings me to my second point, the question of how we prioritize issues on the global health agenda. In recent years, many international health actors have focused their attention and efforts on infectious disease. HIV/AIDS, tuberculosis, and malaria are placing major burdens on developing countries. They cause between 5 and 6 million deaths across the world each year. That's a bit more than the population of Denmark. They also tend to dominate the health agenda. In low-income countries, development actors have joined forces to break the curve of these epidemics. And recent reports show that these efforts are slowly starting to pay off. On the other hand, non-communicable diseases like diabetes, cardiovascular disease, cancers, and chronic respiratory disease already pose a growing challenge for countries across the world. These 4 diseases are the world's biggest killers. Each year, they cause 35 million deaths. That is the same as the population of Canada. It is more than half of all deaths in the world. And these diseases do not only burden rich countries. 80% of deaths occur in low and middle-income countries that already struggle with infectious disease. But despite these alarming figures, there is still a lack of attention on non-communicable disease from the public, the media, and the decision makers. A strategy to drive awareness, mobilization, and intervention, like we see it for infectious disease, is still to be defined and adopted to fight non-communicable disease. Infectious and non-communicable disease represent a double challenge. To address it, we not only need to strengthen health systems across the world, we also need to address the factors that are causing this disease. The draft resolution mentions healthcare and nutrition as two related issues. A good and balanced nutrition is a precondition for being healthy. Malnutrition and unhealthy diet are the gravest threats to public health. In some situations, they lead to underweight, but also, more and more, to overweight and obesity. The rise of infectious and non-communicable disease could be prevented by educating people, particularly children and young adults, about healthy lifestyles and risk factors such as tobacco use, unhealthy diet, physical inactivity, unsafe water, bad nutrition, or unsafe sex. My third and final point also takes its starting point in the resolution. We can only realize the needed change if all stakeholders join forces to address health issues at the level of expertise and decision. Ministries of health, international organizations, which are not in the text of the resolution, and I think they should, NGOs, but also healthcare companies must establish partnerships to ensure that the double challenge of infectious and non-communicable disease is addressed. Actors from other policy areas, especially the business community, must also be part of this effort. To ensure that the right to health becomes a reality, we must understand that a healthy population is a precondition of development. We must approach health as an horizontal matter rather than a vertical one. Priorities on the global health agenda must correspond to the severity of the disease and reflect not only the burden of infectious disease, but also the growing challenge caused by non-communicable disease. To answer these challenges, we must reinforce health systems and address the causes of the disease. This will only be possible if all stakeholders join forces in making this a reality in the future. Thanks for your attention.